Historic announcement yesterday from the U.S. Surgeon General declaring for the first time in American history that firearm violence is a public health crisis. The announcement was accompanied by a 40-page report detailing the severity of the issue and the policies that could be enacted to save lives. Those recommendations include banning automatic rifles, implemented universal background checks, restricting gun use in public spaces, and penalizing those who fail to safely store their firearms. And U.S. Surgeon General Dr. Vivek Murthy joins us now. Thank you very much for coming on this morning for this announcement. So, we would agree there is an epidemic. There's a mass shooting several times a week in America. How does putting the official label of public health crisis on this issue bring us closer to these goals, actually?
Well, Mika, for a long time, this issue has been politicized and polarized, but I think it's time for us to change how we look at it. Instead of looking at it as a political issue, to recognize it for what it is, which is a public health issue. And the power of doing that is severalfold. First, when our office historically has identified an issue as a public health issue, that has typically made it a more urgent priority for the country, but it's also opened up the door for us to take a public health approach to that issue. This is what we did with smoking more than half a century ago, when my predecessor, Luther Terry, identified smoking as an important public health issue and a threat to the health of America. That helped mobilize a series of initiatives in communities, in schools, among parents, among lawmakers. It ultimately brought smoking rates down from 42% in 1964 to less than 12% where they are today. So that's the approach we have to take here. And what's really important, Mika, for people to understand also is that gun violence is not an issue that just affects a small number of people. The ripple effects of gun violence have impacted millions of people across America. There are nearly 50,000 lives we lose each year to gun violence. There are millions more in terms of people who are shot and injured and who survive, people who witness these incidents, family members who lose loved ones, and many more who watch and hear about gun violence every day, including our kids. That has led to 6 out of 10 Americans now fearing that they'll lose a loved one to violence, and more than half of our kids worrying about shootings in their schools.
So you brought up the smoking parallel, which is so interesting because, as you're right, you are correct. It mobilized initiatives and a lot of outreach in schools and understanding about the dangers. It also mobilized massive lawsuits, and the legal realm was really ignited by sort of a sense of just how dangerous cigarettes were. Will that happen in this case? Is that your hope? Or what gets us to banning automatic rifles? What gets us to your goals here in this announcement, universal background checks?
Yeah, so there are a series of strategies we lay out in the report, Mika. You identified some of them, which are focused around firearm risk reduction strategies. Those include strengthening universal background checks, and they also include measures that would seek to put time and space between firearms and individuals who would seek to harm themselves or others. But what they also include are community-based violence intervention strategies, safe storage education programs and laws, advances and expansions in our research funding, as well as expanded access to mental health services. These are all multiple strategies that we've offered for Congress to consider, for the country to consider, and they're actionable. You know, one thing, the things that gives me some hope here is that if you look at the last few years, we've seen some progress. 5-6 years ago, Congress actually, for the first time in decades, put forward funding for gun violence. There's a modest amount of funding. A lot more has to happen there. But they also, for 2 years ago, passed the Bipartisan Safer Communities Act, which is the first federal legislation to address gun violence in 30 years. There is more that we can do here. And these should not be the last steps we take. There are more actions we'll need as a country. But if we build on the strategies I've laid out, if we come at this issue understanding that what I'm understanding, talking to people across America, which is that everyone, regardless of their background, their age, what part of the country they live in, want to live in a world where their kids can go to school without worrying about gun violence, where they can go to church or go for a walk on the street without worrying about being shot. And right now, this fear of gun violence has pervaded the psyche of America. It's affecting day-to-day decisions. Mika, I have to just tell you about a grandmother I spoke to not long ago who told me that her grandchild is scared to wear light-up shoes, the shoes that flash when you take a step, because he doesn't want to be a target for a shooter if there's an active shooting incident in his school. Another mother I spoke to the other day who was tragically in a mass shooting incident and had to run from a shooter. She now doesn't wear flip-flops when she goes outside because on that day, she happened to be in flip-flops and found it was hard to run. And she doesn't want to be in that situation again. You start to see how this is affecting day-to-day decisions, and it doesn't have to be this way. If we understand this as a country, come at this as an issue that affects all of us as a public health concern, I really do believe that we can make progress in saving lives and reducing the mental health toll of gun violence.
Dr. Murty, good morning. It is true that young people now think about things you and I never had to think about growing up in terms of safety at school and public places. It crosses their minds. They go through those drills. This announcement is drawing applause from gun safety advocates, from the American Medical Association. No one could argue that we have a crisis in front of us. It's right there in the data. I think what some people are saying is this is nice, but without the policy side of it, it's kind of symbolic. So how do you take this from where it is right now and push it forward so that there's real change in this country, not to control guns, but to protect people's lives?
Yeah, and here I fundamentally believe that we can respect people's rights and also protect people, create a safer world for them, and that's what we've got to do here in America. What my hope is that this advisory will serve as a foundation for a series of changes that we can make. There are a number of policy changes here for Congress to consider, but think about what happened again with the 1964 tobacco report. That was a foundation for policy change, as well as for a series of other programmatic and educational changes that we made across the country. And if we come together as a nation to say, you know what, this is time for us to make this a priority because it's now become a kids issue, then I think we can make progress. And let me just underscore the kids issue. Gun violence has become the leading cause of death among children and teens in America. That was not true a decade ago. It was not true 2 decades ago. It is true today. And one thing I have seen, in the past as a country is that we have been able to come together and do hard things in the past. And if there's ever a time where we should come together to take on an issue, it should be this one because it is affecting our children. And what could be more important than their well-being?
Hey there, MSNBC fans. I'm Luke Russert, and be sure to join me, Rachel Maddow, Jen Psaki, Lawrence O'Donnell, Steve Kornacki, Joy Reid, and many more September 7th in Brooklyn, MSNBC Live Democracy 2024. Click on the link for ticket information. We will see you there.